Parenteral Nutrition Administration training video by Emeritus Specialty Infusion Services. Please note that the products that are seen in this video may differ slightly in terms of color or size than what you receive at home. Your clinician or your home health agency nurse will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your packet that you received with your first delivery. You will receive a parenteral nutrition binder when you are admitted to our services. This will be provided to you by the clinical liaison in the hospital before you go home, or will be in your first delivery box. This binder will provide you with in-depth information regarding parenteral nutrition and is very useful as you and your caregiver become independent in administering your parenteral nutrition, or PN, which is how we will refer to this during this video, at home. Information about your catheter and medication administration. This video shows cyclic PN infusion, meaning you will hook this up for only certain hours each day. If your PN is continuous, meaning you will remain attached to it 24 hours a day, there are slight differences that your nurse will demonstrate for you. Let's start by familiarizing you with your vascular access device, which is also known as a catheter. In this video, the patient has a catheter in her arm, but it can also be in the chest. The catheter that is inside your vein travels to just above your heart so that the medication can be quickly pushed through your entire venous system. You will have a dressing over the area where your catheter has been inserted. Your nurse will be the one to change this dressing, usually once a week. Notify your pharmacy if this dressing is wet or coming off, and a visit will be arranged to change this dressing. You will be asked to observe this site daily to make sure that there is no redness or drainage from this site, and if there is, you will need to notify your pharmacy. It is important that you or your caregiver be able to give your medication as scheduled, which means that you likely will have an extension set attached to the end of your catheter. The length of this set depends on how long you need it to be to administer your medication safely. This extension set will be changed only by the nurse, so take care to not remove it. If you accidentally remove it, make sure your catheter is clamped and contact your pharmacy right away to have a nurse come and place a new extension set. At the end of this extension set is a small device that is referred to as an end cap or an injection cap. This cap is where you will attach your medication tubing or syringe. Do not ever remove this cap. At the end of this injection cap, you might see yet another small cap that is referred to as a swab cap. This is an extra measure to keep the end of your injection cap clean in between your medication times. Before you begin your scheduled PN infusion, you should clean your hard surface as shown here. Remove the PN and multivitamins from the refrigerator at least an hour before administration and place them on the clean surface area. It might be a good idea to set an alert on your device to remind you of this step. Do not put your PN or the vitamins in a microwave or run warm water over them to hurry up the process. Step 1. Washing your hands. To start with, you will need to wash your hands thoroughly for at least 20 seconds using soap and water or a disinfecting alcohol-based hand sanitizer if you don't have access to soap and water. When finished washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. Step 2. Your parenteral nutrition, or PN. You've already removed your PN bag and multivitamins from the refrigerator. Review the label on your PN bag. Make sure that it has your name. In addition, look at the expiration date. The PN should be consistent in color and free from any visible particles. if the fats in the PN are separated or in globules, or any other of these items cause you concern, do not use and notify your pharmacy. Step 3, your supplies. Gather your supplies. This includes 1 saline syringe, a tubing with filter, a syringe with a needle, 2 vials of multivitamins, and any other additive that your physician has ordered, your room temperature PN, as well as 2 antiseptic pads, a pump, and 2 new batteries. If you are adding more than multivitamins to your bag, you will need another syringe with a needle and the medication vial that has been ordered. You will have the pump and also a backpack to place the PN bag in. In this video, we will be demonstrating the Curlin pump. If your pharmacy uses a different pump than the Curlin, you will be provided with specific instructions for that pump. Take the wrapper off the syringe and place the syringe on the clean surface, along with the other supplies that you have gathered. Because you will be asked to rewash or sanitize your hands frequently throughout this procedure, it is recommended that you have a bottle of hand sanitizer close to you during this process. So now, after you've gathered all the supplies needed, it is time to sanitize your hands. Step 4, adding medications to your PN solution. Check the medication vial or vials for the expiration date or for any noticeable defects or cracks. Remove the protective cover from the multivitamin vials. Cleanse the top of each vial with an antiseptic swab for at least 15 seconds. Remove your medication syringe with a needle from the packaging. Withdraw enough air into the syringe to equal the amount of medication needed. Turn the vial upside down and push the needle of the medication syringe into the vial, and then inject all the air inside the syringe into the vial. Next, pull back on the syringe to fill it with the correct amount of medication needed. With this same syringe, repeat the procedure with the other vial of multivitamins. One of these vials will be clear and one will be bright yellow. You should have 10 mLs total when both vials are drawn up together. If you need to draw up more than 1 syringe of medication to add to the PN bag, be sure to label each syringe with a piece of tape to help you know what is in each syringe. Now, use an antiseptic pad to wipe the medication port on your PN bag. Scrub for at least 15 seconds and allow to dry. Now push the needle of the syringe with the medication into the port of the PN bag. This is the port that you've already cleaned with the antiseptic swab, and inject all the medication from the syringe into the bag. Now, remove the syringe from the port of the bag. Repeat this with all additive medications that your physician has ordered. Clean the bag port each time with an antiseptic swab for at least 15 seconds. Now, gently rotate the bag to mix well and repeat the process for each medication vial that you add. At this point, your PN will be a light yellow color. Place the needles into the sharps container that you have been provided. Step 5, connecting the IV tubing to your PN bag. After your medications have been added to your PN bag, it's now time to connect your tubing. Your PN bag may not already be connected to IV tubing. If your tubing is already connected, you can proceed to step 6, which is preparing your syringes. Sanitize your hands again. Open up your tubing and remove the paper so the tubing is extended. There will be an additional filter in that packaging. Make sure you do not throw that filter away. Close the clamp on the tubing. Carefully remove the protective tab from the PN bag. Make sure you do not touch it or let anything contaminate the port. If something touches it, be sure to scrub it vigorously again for 15 seconds with an antiseptic pad before continuing. Now, remove the plastic cover on the spike of the tubing, and with a pushing and twisting motion, insert it into the PN port. Now, open the additional filter and place it on the end of the tubing. Now get your pump. It's a good practice to change the batteries every day, so this is a good time to replace the batteries. As a reminder, your pump may look different than the one that we're showing in this video. If so, you should have a user's manual guide to assist you, or contact your pharmacy with questions. For this pump tubing, remove the tan piece of plastic that is at one end of the soft part of the tubing. This is the part that will be placed on the pump. Now place the tubing in the pump as shown here. You now need to prime your tubing before you connect to your IV access device. There is a prime button on the machine that will prime the PN for you. Unclamp your tubing and start to prime. Make sure the entire tubing has fluid in it before you connect the tubing to your IV line. Step 6, preparing your syringe. Now you will prepare the syringe. The pre-filled saline syringe has a cap on the end. The saline syringe has a white cap. It's also clearly labeled on the side. Hold the syringe upright. Loosen the cap on the syringe, but do not remove. And gently pull back the plunger of the syringe to pull in a small amount of air. And then push the plunger until a small amount of solution comes out of the syringe. Now you can retighten the cap. This removes any air that might be in the syringe. Step 7, flushing your catheter. You're now ready to flush your catheter. If there is a swab cap on your injection cap, remove it and throw it away. Then, open an antiseptic pad and clean the end of your injection cap vigorously for at least 15 seconds. Do not ever remove this injection cap. If for some reason it is removed or comes off, be sure to clamp your catheter and call your pharmacy right away. Now remove the cap from the end of the saline syringe and attach it to your injection cap by pushing and twisting until it is firmly in place. The end of this syringe is sterile, so if you accidentally touch it with your hands or put it on a surface, then it needs to be thrown away and you will need to get a new syringe. Keeping the syringe end sterile is very important to help keep you from infecting your IV catheter. Unclamp your IV catheter. Push the plunger on the saline syringe slowly or with the pulse method to flush the catheter. To use the pulse method, push the plunger, pause, and then push and pause again until the syringe is empty. Do not force the flush. If you have resistance, contact your pharmacy before proceeding. After you complete this flush, remove the syringe from the injection cap and discard it as instructed by your nurse. Step 8. Initiating your PN infusion. It's now time to clean your hands again with the hand sanitizer. Open another antiseptic pad and clean your injection site again for 15 seconds. Then remove the protective cover from the end of the filter and attach it to your IV access device with a push and a twist motion. Now unclamp the PN tubing and start the pump. For infusions that are not running for 24 hours, the pump is programmed to ramp up or increase its rate to the ordered rate for the first hour, and then it will ramp down or decrease the rate automatically for an hour at the end. If your PN runs continuously day and night, the pump will remain at a consistent rate at all times. This is the procedure for an infusion that does not run continuously over 24 hours. We term this as cyclic. If you are on a continuous infusion over 24 hours, you'll need to flush the catheter with 2 saline syringes after the bag is complete and follow the instructions to start a new bag. You will place your pump and the PN bag in the backpack that you have been provided. This PN bag needs to remain in the backpack, protected from light at all times. If you have an IV pole, you can hang the backpack on that pole, or you can just place it next to you. There is no air in that bag, so it does not need to be upright or hung from a pole in order to infuse properly. When your infusion is complete, the pump will notify you. If you are unable to disconnect at that time, there is extra fluid in the bag, and the pump will go to keep vein open rate until you're able to disconnect. It is important, however, to try to disconnect as close to the scheduled time as possible. Step 9. Disconnecting your PM. When the bag is complete, it is time to flush your catheter with saline and heparin again, if ordered. You can prepare 2 saline and 1 heparin syringe as we instructed earlier. We suggest you flush with 2 full syringes of saline after the infusion to ensure that the IV catheter remains open without any residue. Always swab the end of the infusion cap with an antiseptic pad for 15 seconds between each syringe. Next, instill the syringe of heparin. Then clamp your IV line and place a new swab cap at the end of the injection cap. You can now remove the tubing from the pump and throw away the empty bag and tubing as instructed by your nurse. Congratulations! You've now completed hooking up and disconnecting your PN bag. If you have more than 1 lumen on your vascular access device, there are more steps to be sure to keep all lumens open and to be ready for use. To learn more about that process, please look at the video that is titled Flushing Your Catheter. Your pharmacy is available to help any time of day, any day of the week. Do not hesitate to call us with questions or concerns. This contact information is in your folder. You will also find resources on our website available to you at www.emeritaiv.com. We look forward to the opportunity to serve you.